Okay, good morning everybody. This is my very, very darling and sweet patient, Sahal. We have had at least 3 to 4 consultations now. We've discussed his case thoroughly. We've made a plan A, plan B, plan C. The reason why his case is going to be quite interesting is because he actually, unfortunately for his ethnicity, was born with a slightly lower density around the occipital scalp, which means we need to plan very carefully going forward, because for me, he's a spring chicken. He's very, very young. And in the future, once we reframe his face and it looks good, we all know that we can't ever completely get rid of hair loss. This is a genetic condition. It's your genes. So we must always plan for the future, and he may need further sessions. So to preserve his occipital scalp, we're going to do some body hair transplantation today. We're going to use the beard grafts first, because these often are a very similar texture to the scalp. So with surgery, you can often make a plan. You can, plan it for 3 days. But until you're actually in there, things might change. We don't know what its skin's like, what the texture's like, what the grafts are like underneath. Usually, we have a very, very good idea, but of course, never say never.